it's important that you talk to your clinician about what your goals are. And it's important, and this is what I really like to emphasize, that your clinician listens, that they hear you.
Hey, I'm Greg Grunberg, and welcome to Talk About It, the podcast where we focus on topics that everybody should be talking about, and hopefully they will, or not only talking about, but screaming about.
Epilepsy shouldn't keep you from doing anything that you want to do.
Talk about it. Talk about it. Talk about it.
This season, we are going to continue to talk about living with epilepsy, like my son and millions of Americans who do. We're also going to be looking at other related conditions and causes. Our goal is to knock down, drag out, eliminate stigma, and raise awareness. Oh, and hopefully have a laugh or two along the way. Each of our episodes will feature amazing advocates and champions. We will learn together how to make a real difference in our own lives and in the lives of our communities.
Talking about it is important. It's all about connecting.
Talk about it.
Talk about it.
Talk about it.
Talk about it. Talk about it.
Talk about it.
Thank you for talking about it.
Thank you for talking about it.
New season, new look, new sponsor. Thank you to Neurelis and everyone at Neurelis for sponsoring Talk About It. Talk About It is also sponsored by Jazz Pharmaceuticals. Thank you, Jazz, for always being there for us. All right, let's jump right into this episode of Talk About It. Welcome to this episode of Talk About It, and this falls right in line with our heroes of epilepsy. Today, we have Janet Greenwood. She is a PA. She's a physician's assistant at USC Keck Medical. She has been somebody that has taken care of and been there for us in our epilepsy journey and in Jake's journey. Jake's doing really well, and it's because we have an open and honest dialogue with everyone in the office. Janet and people like her are right there in the middle, have tremendous communication with the doctors in the network and also with the patients that come in. And she'll talk more about that, but this is fantastic. We're doing a two-parter. This is part one of two episodes back to back in our conversation talking about epilepsy and seizures and what to do, what not to do, how to talk about it with your doctor, blah, blah, blah. This is Janet Greenwood. You're not going to want to miss this. Take notes, folks. This is part one. Enjoy. Janet, thank you so much for being on the podcast.
Thank you so much, Greg, for having me. I so appreciate it. And I think this is going to be a great session. And let's get started.
Let's go. So let's let people know who you are, because you are the person that we turn to and have turned to for years now when it comes to Jake and his care. And he, whenever we have a question, we'll text you, or Jake sees you in the office. Your official title is Clinical Instructor of Neurology at Keck Medicine of USC, right?
Yes,
okay.
That's correct. So I am what's considered a mid-level practitioner. I am a physician assistant. I only see patients with epilepsy. So a mid-level practitioner, physician assistant, nurse practitioner, nurse, doctor. I'm the person kind of in the middle. So I work in tandem with a supervising physician that also specializes in epilepsy.
Okay, so does every epileptologist have someone in your position that works with them, or is it just epileptologist and nurse?
Some of them, it's just epileptologist and nurse. Not all epileptologists have a physician assistant or a nurse practitioner. I actually work with 5 doctors here. So I support all 5 doctors, all epileptologists in our practice.
Wow. Okay.
So I'm busy.
You're very busy helping
Yes.
all of those doctors, and then all of the patients that are seeing all of those doctors. How do you find time? And I know we're not special. Like, you do this for everybody, but are you just insanely busy top to bottom every day?
Every day is something different. It's new. Yes, I'm very busy. And yeah, I think that's the role of the physician assistant, is to provide that extra care that sometimes physicians get so busy on maybe some higher level things that I can kind of make sure that I'm the glue between the physician, the patient, and myself, so that if the physician is too busy, then I can make sure I pick up that slack. So at USC, we like to think of ourselves as being very patient-centric, and that's kind of the role that I I fill. Hopefully, I do a good job on that. You get messages, phone calls, text messages, all of that, but it's important for the patients to have that care.
Yeah.
I think it's really, really important.
So you just stressed something that I want everybody who's listening, everybody who's watching this, it's really important. First of all, it's next to impossible to get in to see an epileptologist. They're so busy. But be at the beginning at least, or when you're looking for a second opinion, be a little bit more, don't settle. Like find somebody that you're really, really comfortable with, right? That is so, so important. And find somebody that has a PA working in their office.
So I think that's a great point. I think it's important for patients. I always tell my patients, you have to be your own best advocate. And then patients or their caregiver, their parent, their spouse, it's always good to have a second set of ears. And it's important that the patient is the customer, right? And when they come into the clinician's office, whether it's the PA or the epileptologist, they should come in with certain expectations from their provider, and they need to work together. It needs to be a team. And that's the way I like to think about it, is that patients have their goals, right? For some patients, it is to be completely seizure free, and that may not always be realistic. For some patients, it may be let's minimize side effects, but it's important that you talk to your clinician about what your goals are. And it's important, and this is what I really like to emphasize, that your clinician listens, that they hear you, that they talk to you, and it's a two-way street. It isn't just the physician or the PA saying, do this, this, and this, and then get out of my office. It's, hey, I need to hear what's working and what's not working. I can't read your mind is what I'll tell patients. If you don't tell me, I don't know, right? So I encourage patients to write things down before they come, or write things down. I try to write things down for my patients so that when they leave, it's thought that by the time the patient gets to the checkout desk, they've already forgotten 30% of what's happened in the clinic.
Yeah.
And that's for patients without memory issues or cognitive impairment. So you add that with the medications that our patients are on, you can imagine that it's hard for them to remember. So it's okay for them to take notes. It's okay. I try to really write things down for patients so that when they leave, they can have a kind of synopsis of what we've talked about.
I love it. And I'm going to encourage everyone right now to listen to this entire podcast. Of all episodes we've done, this is really, really important because this is practical stuff. And this is going to lead to just so much more confidence in your care. It all works together, right? You and I, we communicate. Jake communicates with you, and it just makes us feel better. It brings the level of stress down. It hasn't grown my hair back yet, but it will at some point. But,
well, I mean, for Jake is a great example. For all our patients, that we set goals and we try to work on those goals at each individual appointment. And it's really an important part of our care is that we sit down and we listen to the patient and make sure that their goals are achieved.
I love it. All right. A couple of just personal questions for you because you are my hero. I want to know, how did you get to where you are? So first question, what inspired you to work in neurology, specifically with people with epilepsy?
So my background is a little different. I worked as a PA, became a PA in 1992, and then I worked in industry for the treatment of epilepsy. And my clinical site was USC. And I got to the point where I was like, I'm missing patient care. So Dr. Heck inspired me to come back into medicine. I love this patient population. I love patients with epilepsy. I really enjoy the younger patients, 18 to 25, and then the older patients, because I think those two groups are really interesting. They have different needs, especially the younger ones. They're trying to figure out who they are as adults. And then the older patients, they have different needs also. So it's a great patient population. You see patients from all spectrums.
Well, you have a level of understanding and care that I just haven't seen in our entire journey, and we love you for it. So thank you for that.
Real quick, I just wanted to
you.
follow up. Keck has a Dr. Heck
Yes.
Did I
Yes.
understand that?
Yes.
Sorry.
Yeah.
Dr. Heck from Keck.
Dr. Heck
Yes.
from Keck. Give him Heck, Keck. Or give him Keck, Heck. I don't know. I don't know which it is.
Coming up on Talk About It.
Epilepsy doesn't define that person. And I wish people would see people beyond their seizures, see them for who they are, what they're doing in their life. Not that it's just, that person has a seizure disorder.
Yeah.
Every patient has a unique story.
Okay, I just want to be clear. The level of connection, the level of comfort that we have had, that Jake has had with his doctors and the caregivers, the clinicians, the nurses over the years has been absolutely incredible everywhere we've gone. But you'll get to a point where you'll see what we're talking about, what I'm referring to. When I say I've never seen this before, I just mean that there's that little difference. Or, as people change within the office that you go to, you'll get it. You'll see what I'm talking about when all of a sudden there's somebody that you connect with in a very different way. So don't ever give up looking for that connection, because it's so easy. The more comfortable you are, the more you're able to share, the more you talk about, and the better your care will get. Trust me. The connection that we're so lucky to have with Janet, it's out there. And don't get me wrong, there's different levels of connection, and you might be comfortable with a different level of connection, but we found it with Janet and everybody at USC Keck Medical, but we've had it throughout the years with the other places that we've also seeked care. So it's out there, and it's out there all over the place. Keep looking and keep talking about it. Based on your patient engagement over all these years, what do you wish more people understood about what it's like for your patients to live with epilepsy?
I wish people would understand that epilepsy doesn't define that person. That epilepsy, a seizure is a 30-second or a minute phenomenon. It's not who they are as a person. And I wish people would see people beyond their seizures, see them for who they are, see them for their heart, see them for what else they've accomplished in their life and what they're doing in their life. Not that it's just, that person has a seizure disorder and that's who they are.
Yeah.
Every patient has a unique story.
Yeah. And when you think about it, everybody's got something. And if you're listening to this right now and you've got asthma, would you want people to say, oh, that's the woman with asthma? No. That's not the way you're defined. So you have epilepsy. Epilepsy doesn't have you. And that's the way the world needs to perceive you, I believe. And it's important. Okay, next question. How has your approach to epilepsy care changed by hearing and talking with patients about their daily lives? And does that evolve? Because, the world's changing. So how people are living with epilepsy must be changing.
Yeah, I agree. I think I learned a really important lesson when I was explaining to a patient about a procedure, and I told the patient, we do this procedure all the time. And he stopped me in my tracks and he said, well, that's great, but this is my first time. And I thought, wow.
Yeah.
Wow. It made me realize that, it's not so like, we just do this and it's no big deal. For that patient, it was a big deal. And it made me realize that I needed to make sure that I wasn't so cavalier about that. This is just common sense, right? This is just common and this is what we do.
Yeah.
It's that person has fear and is nervous. And so it's made me realize that when you're explaining things to patients, whether it's medications or procedures, you need to make sure that you explain it in a level that makes them feel comfortable, that they understand the risks and the benefits.
Yeah, it's true. And some people, even though they're having seizures, they're not as educated. It's not their fault. They just, entered this world. So they don't know anything about, like we did. We didn't know anything about it, when it first started at all. So it's important to take that into account. I have that experience when I get a call from a parent. I have to take that into account, that they're new to it.
Right. They're totally new to it. And it's like, hey, well, you know everything about it, but I don't. So Take the time, again, as a clinician, make sure your clinician takes the time to explain it to you.
Yeah. And as a patient, explain that this is all new to me. So, it's that thing where when people say, explain it to me like I'm a 4-year-old, it's like, it's true. It's like, explain it to me like I know nothing about it. All right. Many people still don't talk openly about their seizures with the ones they love, with their support system, with coworkers at work. Why do you think that still is?
Yeah, there's just still that stigma, that there's somehow that because of when the seizure happens, there's that sometimes confusion, sometimes they may have urinary incontinence, they may bite their lip, they may become agitated, and they're embarrassed. They don't want people to know. And I think they feel that if they don't talk about it, then it's not, it's like if you don't talk about it, then it's not real, right? Like we can just avoid it.
Yeah.
And it's something that we need to work on, is making sure that we do talk about it, that it's not a personal flaw, right? It's like mental health issues. We need to talk about these things. We need to make sure that everyone understands and is comfortable with it.
Yeah, and the first way to do that is to talk about it.
Right. I had an example. I had a patient who is in a band, and he was new to epilepsy, and he was going to be traveling. So I brought his whole band in to the clinic and said, okay, let's come on in.
Wow.
And we talked about it so that they were not going to be overwhelmed when they were on the road, what to do in an emergency, how to take care of him.
That's incredible.
What, triggers he might have, like, okay, you're young, you're in a band, he can't drink. It's just not allowed for him, right? So they got it. And he went on his journey, and he's doing great. And I was happy to do that. So
I love that.
But it broke the stigma. He didn't have to worry about what other people were thinking. It was just all out in the open.
I mean, look, I'm a cheap guy, but what a great way to get free tickets, Janet. Bring the whole band in and be like, look, guys,
the whole band in.
We can talk about this, but I'm getting front row seats backstage next time.
Can you do that for our band, by the way? Not for epilepsy, but just general therapy.
Exactly. By the way, Janet, you have to come see our band, the Action Figures Band. You got to see us next time we play.
You let me know, and I'll be there.
100%. No, you're our absolutely. It'll be our treat.
Just send the invoice to Greg for the counseling.
Right. Exactly.
Coming up on Talk About It.
The misconception out there is that a seizure is big tonic-clonic movements with, biting the tongue, falling on the floor. And that is a very small percentage of seizures. Focal seizures don't always present like that. Making sure that you can define the seizure type helps people around you be aware.
I just have to stop for a second. Having the other members of a band come into the doctor's office and learn what to do, what not to do in case that band member has a seizure, that's brilliant. I love it. So think about that. We have a band called the Action Figures Band. Nick, our producer, Nick, is our musical director, brilliant musician. He's in the band. And Jake is in our band. Jake plays percussion. He travels on the road with us. Everybody needs to know what to do in case Jake has a seizure. Now, I've been very vocal about it, but bringing close friends and family in your support group into the doctor's office with you, not only are they going to be able to ask the questions that maybe they weren't comfortable asking you, but they're also going to be able to share their experiences if they had ever seen you have a seizure. So they're going to be able to say, oh, you know what? It's interesting. I did notice one time that you blah, blah, blah. It's all going to help your story. It's all going to help you get better care. And it's all going to make people around you feel more confident in case something should happen, what to do that could save your life. So why not make it a social event? Go have lunch, stop by your doctor's office. Hey, everybody, I want you to meet my doctor. I love my doctor. I love my clinician. Love my PA. It's just a great thing. It's a great idea. I'm not saying that you bring the entire baseball team in with you, but to have a couple of like the coach, the Little League coach or whatever, you never know. Just ask and talk about it. This is an important question. What happens when people do talk about it with you, with the doctors there? How can that change how they're treated by others in the real world, but more importantly, by their doctor? When they have a good dialogue, what does that mean?
It opens up the conversation, so things that patients may be reluctant to have talked about become important. right? So a patient, if a doctor's just like, okay, how many seizures have you had? And blah, 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 blah. Are you having any side effects? And then you go. If you have that dialogue and it's comfortable, then you may say, hey, you know what? I also was experiencing this. Is this important? And if you don't have that dialogue and that comfort, then you may not bring it up, and it may be important. It may be it's a side effect to a medication that the patient didn't understand, or it's a type of seizure that they didn't know needed to be treated and no one had really asked them. So that dialogue, that comfort needs to be there. But yeah, for sure, the dialogue, and also talking to the family members, making sure that they understand and they're aware. That, hey, sometimes maybe he won't, or he or she won't be running on full cylinders because they are having side effects, and you need to be aware of that.
Yeah, and
but again,
the easier the dialogue flows, the more not just the seizure tracking and sleep patterns and diet, that's all really important. But then you get into lifestyle stuff that can also really help diagnose, where somebody says, oh, I'm out late at night, I'm a band. Oh, you're in a band? Like that, the more you talk, and again, I don't want to use all the doctor's time for this kind of thing, but just be open so that when you do get asked a question that's personal, are you dating? What's going on? Like stuff like that can really lead to it, right? It can trigger where you go, oh, there must be anxiety about this or that in your life because you're going through a stressful time. Maybe that's why you're having seizures. There's so much more to it. Right?
Right. I always tell my patients, we have to take care of your body, your mind, and your spirit. So the body is kind of taking care of your epilepsy. Your mind is, are you having anxiety issues? Are you having depression issues? Your spirit is, are you your mental health, right? Making sure we're taking care of that. So we need to make sure that I tell patients that if I can take care of your epilepsy, but if you have diabetes or heart disease, we need to make sure all of that other stuff is taken care of so that you can have the best outcome for your epilepsy. So if you're not exercising, if your weight is too much, if you're not sleeping well,
yes, and yes.
Well, yes, all of that is important.
Sorry. Yeah.
Yes.
No, these are all great questions. You're 100% right. There's so much more that goes into it than just what you'd expect. So talk about it with your doctor.
Agree.
Okay, pretend like I don't know any of this and talk to me like I'm an 8-year-old. What is the difference between a focal and a generalized seizure? And why is it important to talk about the different types?
Great question. When we talk about epilepsy and seizures, we usually put them into two different buckets. We usually will say a patient has either focal seizures or generalized seizures. Focal seizures are just that. It comes from a specific focus, meaning that we know the street, the location, maybe not the house, but we know the street. So we know maybe what hemisphere it's coming from, which lobe of the brain it's coming from. Not always, but sometimes, we usually know. It's usually focal. Generalized, meaning the electrical activity starts over both hemispheres. And so the symptoms are different. The medications are different. For focal epilepsy, many times we can do surgery. We can do other types of treatment options. Generalized, we usually can't do a surgery, but we can do neuromodulation. So it's very important to know the different seizure types, how they present, so that we can kind of pinpoint what the best treatment options are.
Yeah, but that really does define it in a way that I can understand. I'm sure a lot of other people can understand. Focal comes from a very specific point on the brain map, right? A very specific area. Right. And generalized is the whole brain is the electrical activity.
It's like a big electrical storm.
Yeah, that's great. Okay. This question, I'm just going to read. You tell me if you can answer this. Some seizures don't look like what people expect. That is true, right? We all think
that is so true.
We all think of, falling down to the floor and shaking. There's so many different types of seizures. What should we be talking more about when it comes to seizure signs?
It's important when you're speaking with your clinician. If you have focal seizures, what type of focal seizure do you have? There are focal seizures that are you lose awareness. There are focal seizures that are just motor movements, meaning maybe your hands or your legs move. And so it's important to understand that sometimes a focal seizure will just be a blank stare. So I think making sure that you can define the seizure type helps people around you be aware, like, oh, I just saw, my son have a blank stare. So I didn't realize that that's a seizure. The misconception out there is that a seizure is big tonic-clonic movements with, biting the tongue, falling on the floor, foaming at the mouth. And that is a very small percentage of seizures. Focal seizures don't always present like that. So making sure that you talk to your doctor. I even have a chart in my office of different seizure types. And I put it up there just on a whim, and patients will go up to it and try to figure out, oh, do I have this seizure type? And so again, it opens up a conversation. No, you have this type. Okay. And it has like what to do, what not to do, and how to address it.
Every neurologist, every epileptologist needs that chart. It's like the pain chart when you go and you see the emojis, And,
yes.
and I finally look like one of those emojis now, which I'm very excited about. Okay, we hear from people who feel dismissed, especially women and people of color. And it's horrible. And how do we change that? Yeah.
So people of color has been something that I've thought about since working as a PA. It amazes me that we don't see more people of color in our clinic. I think there needs to be more advocacy from either, groups, Epilepsy Foundation or other groups, going out to those communities and addressing it, whether it's at clinics, but it is a big issue because those patients are out there and they're suffering. For women, I think that, again, they tend to get dismissed most in medicine in general, whether it's epilepsy or heart disease in general. So I think, again, there needs to be more recognition and more advocacy, especially because women with epilepsy have different issues, and the medications have to be different if they want to have pregnancy. At USC, we're fortunate that we have a physician who specializes in women with epilepsy. So that's important to make sure that if you are someone of childbearing age, that you find a clinician who specializes in that type of epilepsy.
So if you're out there and you're listening to this, and this touches you, this affects you, you can relate to this, don't be afraid to talk about it. The care is out there for you. So pursue it and talk about it and get the right care that you need, because it's out there. Thank you to Janet Greenwood. Thank you to every Janet Greenwood out there. All the doctors, all the epileptologists, all the clinicians. That's what these 2 episodes are about. This was part 1. Stay tuned, because the next episode of Talk About It, we continue this conversation with Janet and answer even more of your questions. We will see you on the next episode of Talk About It.
Thank you for tuning in to this episode of Talk About It with Greg Grunberg. Sponsored by Neurelis and by Jazz Pharmaceuticals. Thank you to our special guests for joining us, and thank you JJ Abrams for the theme music that you're hearing right now. Talk About It is produced by Ken Lowenberg, Greg Grunberg and Nick Marzok. Editing, directing and incidental music by Nick Marzok. Go to talkaboutonvideo.com to watch these episodes, and as always, don't forget to talk about it. This podcast is a production of the Talk About It Company and Motel Podcasts.